Hello, my name is Amit Shah, and I'm the Director of Cardiac Rehabilitation at the Atlanta VA Medical Center. Welcome to our Cardiac Rehab program. The purpose of this video is to tell you about cardiac prevention and our program, and to help you in making decisions for your heart. Today, there will be an exercise where we will talk about heart disease in general and healthy lifestyle, and how we can partner with you in living a healthier lifestyle. We will then enroll in home-based cardiac rehabilitation. Why do we get heart attacks? This may affect many of you in our program. Heart attacks happen from blockages in the blood vessels of our heart known as the coronary arteries. Normally, the coronary arteries are able to transport blood to our heart in areas that it needs to go to keep our heart pumping, usually around 60 to 100 times per minute. This process requires a lot of oxygen. Heart attacks happen when the flow of the coronary arteries, the blood flow, gets blocked with atherosclerosis. These are blockages that are filled with immune cells, cholesterol, and blood clots, which can happen for a number of reasons. Typically, heart attacks have a combination of lipid-filled or cholesterol-filled blockages that invade our vessel walls, as well as blood clots that form on top of these invasions on the wall. And what happens then is that once the heart has less blood flow, then we experience chest pain, shortness of breath, or other problems that we can feel. The scary part is sometimes we don't feel anything, and other times our hearts can jump out of rhythm, and that can be fatal if that happens and our hearts are out of rhythm and not pumping anything at all. Another complication of heart disease is heart failure. Sometimes people have blockages and they get heart failure. Other times they can develop heart failure without blockages. Heart failure is most well known as a problem where the heart is too weak to pump, and because there is less blood flow pumping out of the heart, what can happen is our brains and our bodies have less blood flow. The other problem is that blood flow can back up into our legs and our lungs. We can feel short of breath, we can have swollen bellies, we can have swollen legs. Sometimes in heart failure, it's hard to eat a full meal because the blood is backing up into our bellies and filling up our stomachs such that we can no longer fit as much food anymore. In other types of heart failure, the heart is really thick and stiff, and because of this, blood has a hard time flowing through the heart and blood backs up as well. You can think of heart failure as a traffic jam, such as you may have experienced on your way here, with the traffic lights being red so much that cars back up in a big long line. This is what can happen with heart failure, and as a result, the red blood cells fill up in areas that it should not go. Heart disease can happen for reasons that we inherit as well. In about a third of cases, that is a major reason for heart disease. But what we do in our lives, our lifestyle, plays a very important role and can overcome some of the vulnerability we might have because of genetic reasons. Our environment is important. This shapes our food choices, for example, and the people we associate with. The other choices we make, let's say, for example, whether we want to smoke a cigarette, is in part depending on the environment. But ultimately, our lifestyle choices, what we choose to eat, and our emotions, our mood, those factors play a very, very big role in developing heart disease. Sometimes we may not realize that certain things we are doing are unhealthy. And through our program, we can identify the areas that may be changeable so that we can reduce our risk in our lifestyle. Heart attacks by themselves are very difficult things to deal with, as you may have experienced. The problem is that people who develop a first heart attack are more likely to develop a second heart attack within the first year at least 1 in 5 people will have another type of hospitalization or even die within the first year after a heart attack. Because of this, we take prevention very, very seriously and offer programs like ours. Whether or not someone has a hospitalization or dies, their quality of life, ability to live their everyday life, doing what they choose to do, can be affected by heart disease, especially if someone has chest pain or shortness of breath. This is a very important part. Lifestyle changes, such as eating healthy, can make a huge difference with this as well. And part of the goals of our program is to improve your quality of life. Healthy lifestyle can reduce your risk by 80%. And there are a number of ways that we can go about living a healthier lifestyle. One of the foundations of cardiac rehabilitation is regular exercise. This can range from supervised activities to home activities, and our home-based program is focused on home activities. I will now transition to a video from one of our coaches, Renee Nazar, that talks about the benefits of exercise.
Hippocrates says, walking is man's best medicine. Come on, babies, come on, babies. Turns out he may be right. Health and Human Services created new physical activity guidelines, which reinforce the importance of moving more and sitting less. They recommend 150 to 300 minutes of moderately intense aerobic activity weekly. And this means to have your heart rate up and your breathing rate up for the duration of the aerobic session. It can be as simple as bringing a brisk walk or hike into your daily routine. These recommendations are based on new evidence supporting the connections between physical activity, disease prevention, and quality of life. Physical activity has a strong and positive impact on blood pressure, blood glucose, and body weight. It decreases the overall risk for cardiovascular disease. Exercise lifts your mood, boosts your energy, reduces stress, and improves your heart health. So make more time for movement and activity to get your blood pumping. Walking, gardening, hiking, biking. Even cleaning can be a good workout. And don't forget swimming. It's easy on the joints. Whatever you enjoy, do it. The coaches of Home-Based Cardiac Rehab will design a personalized exercise program to meet your current lifestyle. And by the time you complete our 12-week program, we aim for 30-minute aerobic sessions, 5 times weekly for the most benefit. So whatever you enjoy doing, do it for your heart, do it for your life.
Another part of healthy living is adopting a healthy diet. This includes meals that are low in salt and rich in whole grains, fruits, and vegetables. It is important that foods that are really good for your heart are emphasized, and that foods that are really bad for your heart are minimized. This is really difficult to do. There are some foods that are easily understandable as healthy, and there are foods that are such as, for example, soda with added sugar that are easily identifiable as harmful. But this process of choosing the best foods, what's right for you, and what's most practical for you can be very difficult, and our team is here to help you with that. I'd like to now show you a video by one of our doctors, Dr. Maloff, that talks about healthy diet.
The health of your heart is strongly related to the foods you eat. Improving your diet can help prevent you from having future heart attacks and keep you out of the hospital. Our cardiac rehab coaches would love to work with you on adopting healthier dietary habits that are straightforward and practical. Here are a few recommendations for adopting a heart-healthy diet right when you leave the hospital. Number 1, eat more fresh vegetables and fruits. Try adding at least 1 fresh vegetable to your breakfast, lunch, and dinner. Number 2, Eat more whole grains, nuts, and seeds. Try replacing refined or processed carbohydrates with 100% whole grains, brown rice, quinoa, and other complex carbs. Number 3, eat more fish, such as salmon, sardines, trout, mackerel, at least 2 to 3 times per week. Number 4, replace red meats such as beef, veal, pork, and lamb with healthier proteins such as roasted chicken and fish. You can also replace meat with legumes such as chickpeas, lentils, and beans. Number 5, avoid refined sweets such as cakes, cookies, pastries, sodas, and fruit juices. Try snacking on fresh fruit instead. Number 6, eat good fats such as olive oil instead of butter or lard. Also try roasting or baking rather than frying, and replace mayonnaise with low-fat Greek yogurt or avocados. Eating healthy doesn't have to be overwhelming or extremely restrictive. Start by choosing just 1 or 2 healthy changes to make to your diet that are realistic for you. Once you've mastered those goals you've set for yourself, choose another couple of heart-healthy choices to incorporate. You can do it, and we're here to help.
To help you with your healthy diet, we also have available to you a dietitian, Yakutullah Ibrahim Muhammad, who can meet with you virtually or in person to talk to you about different options. If you look at number 3 on this diagram, reduced stress is an important part of living a healthy lifestyle. This includes exercises to help you to control your daily stress. It can be relaxation exercises. It can also be other recreational activities or hobbies that can help you to feel better emotionally. Having heart disease itself is very stressful, and unfortunately, once someone develops heart disease and has the stress from that, this can make it harder to live a healthy lifestyle in general. We take this very seriously and have partnered with health psychology, but also as part of our program, actively assess and discuss stress. We now have a video by Dr. Johnson to talk about stress and heart disease from the health psychology perspective.
Having a heart event is scary and stressful. Many experience significant anxiety afterwards, which can lead to future cardiac events. Our Atlanta VA's home-based cardiac rehab program is here to help. We provide proven and easy-to-use techniques for stress management, tools that you can use in your everyday life. Heart disease creates far too many overwhelming thoughts for the veterans we serve each day. What does the future look like for me? Will I be able to go back to work? How will this change my relationships? These thoughts detract from the ability to navigate and feel in control of this next chapter in life. We offer simple yet powerful tools thoughtfully developed for veterans to address the anxiety, tension, and discomfort that plays a role in coping with heart disease. Our veterans report one of the best parts of the program is the care and compassion they receive from their coaches. They also commend the team approach in helping them make important changes. Remember, you are not alone. We really look forward to working alongside you in your recovery.
Number 4 on this list looks at medical therapy for heart disease. Over the years, we have found that there are a number of key medicines that can help to prevent future heart attacks. Each medicine can reduce your risk by 20 to 30%. Some very important medicines include blood thinners such as aspirin, Plavix, ticagrelor, or prasugrel. And many people who have received stents need to be taking both aspirin and either Plavix or ticagrelor every single day. Unfortunately, many people miss these very important medications, and this can lead to near fatal or fatal heart attacks if they are missed. As part of our program, we can help you overcome any barriers that relate to not having medications and at least help you with that. We encourage you to also be in contact with your prescribing doctor or our team about any problems you might have with medicines. We are happy to prescribe you a pill box to help you create a good system to remember to take the medicines, as this can sometimes be the most difficult part. Please review your medicines with your doctor and your coach and ask questions about what the medicines are for and why it's important to take them. The more you know about your medicines and the better habits you have with your medicines, the more likely you are to have success with medical therapy. Medical therapy by itself can be an extremely powerful way to cut your risk by at least 50% for a future heart attack or death. Lastly, smoking is a very important risk factor for heart disease, and people who smoke double their risk of having another heart disease event. Smoking also reduces the amount of blood flow to your heart in general, and after every single cigarette, your heart has less blood flow. This may increase your risk of dying suddenly from heart disease. Smoking is expensive, and it also increasingly is socially isolating sometimes. There are many reasons to quit smoking, but we understand how difficult it is as well. Some of you are ready to quit smoking, whereas others may not be ready and or may not be interested in quitting smoking. If you are a smoker, we'll be happy to discuss this with you, but can understand people's different perspectives on the matter and are happy to work with you as you see best fit. Health psychology offers many services that may be of interest to veterans. Stress can be central to living a healthy lifestyle, from the perspective that people who have a lot of stress have a very difficult time adopting new healthy behaviors because of stress being such a barrier to behavior change. We'd be happy to refer you to health psychology as needed to learn coping skills for stress, to adjust to new changes living with heart disease, helping with your mood, accepting that heart disease is now a diagnosis for you, helping you to return to physical activity and quitting smoking, improving your sex life and talking about that, and managing everyday challenges. When thinking about our program and other programs, it's important to consider our program and the benefits and how it may or may not be the best thing for you when considering what else is out there. Our home-based program offers personalized telephone or video coaching visits over the course of 3 months, and it has a focus on adopting a healthy lifestyle, healthy habits. One important piece is that the weekly calls do not charge copays for those of you who do have to pay copays for your visits, and we have found that veterans that do our program have half the risk of coming back to the hospital or of dying compared to veterans who do not do our program. Center-based cardiac rehabilitation is a program that we can arrange through community care that offers in-person coaching at a gym, usually a hospital gym, where you are monitored. This may have copays. Oftentimes it feels like there's a personal trainer and you are able to work out with an exercise physiologist on their equipment. You can also network with other veterans doing the program at the same time. Typically, this is done 3 sessions per week for 12 weeks. People who do center-based cardiac rehabilitation also have their risk reduced by 50%. Programs like this also offer education and counseling as needed usually. Hybrid cardiac rehabilitation is one where you would do both home-based and center-based and try to get the best of both worlds. It's possible that doing both offers additional benefit because you can experience both the benefits of the coaching and developing new habits, but also have a structured way to have exercise at a center with monitoring. Most of the time, when we give an exercise prescription, exercise is prescribed with safety in mind. And so monitoring usually is not necessary for most people. The goal today is to see how your body is able to handle exercise with an exercise test so that we can get a better sense of what kinds of exercises are safe for you. So from a safety perspective, home-based cardiac rehabilitation can be as safe as center-based cardiac rehabilitation, and we will be happy to talk to you about that. Whole health is One of the other opportunities that we have at the VA that has a lot of overlap with this program, we are officially partnering with them and offering whole health consultation for all the veterans in our program. Whole health is a different way of approaching healthcare where you are at the center of your health. It focuses on your mind, body, and spirit, and your well-being. It offers programs in movement, such as, for example, Tai Chi, surroundings, personal development, nutrition, talks about sleep, talks about your relationships, your spirituality and your connection to others, and also the power of the mind in thinking about relaxation and healing. This picture shows the whole health circle of health, which focuses on prevention and is complementary to the care that you receive from your doctor in a traditional setting. In summary, whole health places you, the veteran, at the center and focuses on your life activities, community, and really works to optimize your activities and give meaning to what you do, both with your provider and with your community and on your own. This program also offers technology as a way to help you with your cardiac rehabilitation. Some of you may be comfortable with technology. Others may be perhaps afraid of technology, and others still may be neutral about technology but willing to learn. We have an optional research program with an app called Movin that allows you to manage your wellness exercises through an app, and it can be installed on a tablet or on a smartphone. It allows you to do some additional things that normally we would not be able to do, such as receive and send messages with your coach through the dashboard. It offers videos, and it offers a digital logbook. This program is completely optional. If you do not do the program, then pen and paper is the way that we would suggest that you manage your activities and your progress. This can work perfectly well for individuals who prefer not to use the technology approach. This is a research study because the program is, as of now, outside of the VA firewall. What this means is that your information would need to be stored on the Moving Analytics company website, where, although it is extremely safe with lots of standard protections that are effective and used by most hospital systems, because it is outside of the VA, for now we have to go through a research protocol. However, it is extremely safe. There are added parts to the research project. While the app is provided as part of the research, we do ask for your feedback with a questionnaire and perhaps a survey after the program is over. Other risks of technology involve dealing with the possibility of it not working and those frustrations. We'd like to reiterate, though, that this is completely optional. And so if for some reason the app does not work well, we would invite you to go back to using pen and paper. And we are happy to discuss any concerns that may come up through the process of using this technology. In addition, we offer different equipment and different ways to help to track your activity so that you can communicate best with your coach and also evaluate yourself on how you're doing. We do not have medical devices to track activity, but there are consumer devices that you can buy in a store that are pretty good and offered through us. We cannot vouch for their accuracy from a medical perspective. The Food and Drug Administration has not cleared these devices for use in cardiac rehab. However, these are devices that many have found very useful. The Fitbit, which we can offer to you as part of our research program, helps to track your steps, your heart rate, exercise, sleep, diet, and it also has a built-in program for doing breathing exercises to help with stress. There are alternative pedometers that do not require a smartphone and can be also very good for tracking these things that we can offer as well if you choose not to do research. We also offer resistance bands to help with strength training, a peddler, which you can use with your hands or legs to get additional exercise. This is really good for people with, for example, knee problems or hip problems that have a hard time walking, but have no problems using their arms to exercise. There's a workbook that we can offer you, and we can also help you to get started with home telehealth. The telehealth program is a new program from the VA that allows you to have a virtual visit with your provider. Virtual visits are visits where you can see your provider as if you were there in person, but through the video screen. This requires using your own device and a strong internet connection, but we can also, through the VA, provide you a tablet, for example, to be able to do video chatting with your coach. This is very important to consider, given that a lot of communication can be done more effectively if we have video and audio enabled. And I encourage you to seriously consider the telehealth program. We will be happy to do a demonstration with you on your device or a device we provide to see if it could be right for you. That's the end of this orientation session. Next, what we're going to do is we're going to offer you a choice on how you would like to best engage with the next steps on living a healthier life with better quality of life and better habits. If you would like, you can fill out the form that's in your folder that discusses choosing whole health, for example, center-based cardiac rehabilitation. We can also talk about the research program, and you can choose for that as well. Many of you will likely need lab work, and we can put those orders in. We also have surveys that will help us to get to know you and your needs as you go through the program. We will also do an exercise test. This may be walking in the hallway or an exercise treadmill test, and this helps with your exercise prescription. If you choose to engage in research, then we'll also do the onboarding for technology. There is some paperwork that research does involve, which is an informed consent document and a HIPAA document. We can do onboarding and trying with telehealth. And finally, before you go, we'll set you up with a follow-up appointment that would allow you to, number one, schedule your first coaching visit, and two, schedule your follow-up exercise test for once the 12-week program is over.